Okay. I guess that means we're starting. So, hi everyone. My name is Taylor Danko. I am the marketing coordinator here at HR for Health. In today's webinar, we're going to cover 17 things that we don't do. And we want to show you all of these features that we have designed with you in mind and why we have chosen not to put some features in it. So next I'll go over who is hosting today, and that is Ryan. She is a software expert and a vital member of the HR for Health team. She is so skilled at increasing efficiency and effectiveness for our healthcare customers. Her secret weapon is using autopilot for our software. So putting things in automation, have it do it for you. And she works with the product team to go above and beyond by determining which features we enhance or update and develop based on what they see from our own clients that use our software currently. They analyze the market, so who we're competing against, and then they kind of look at general softwares because there's a lot of people creating stuff out there. And then they also take in the feedback from those who are using our software on a daily basis. So that means that they hear back from people, whether it be through emails, comments, or calls, and then they can also gather data just from people using the software, and they can get a lot of insights on that and how it's being used. So next, I'll tell you about what we're going to run through today. It seems short, but it's really not. We didn't have to have too many sections for this, so we're going to go through the 17 things that we don't do. And then at the end, there is a content download that you can scan with your cell phone for a QR code. And if you can't do that, if you're watching this on your phone or you miss it to download the option, then we will send it to you once we follow up with all of those who attended. And it will also be ready for you whenever you need it, so it's not time sensitive. And then we'll give you ways that you can contact us. And lastly, I want to tell you a little bit about HR for Health in case you haven't heard of it. And our mission is to simplify HR processes and make them less stressful for businesses of all sizes. We bring to the table a combination of HR expertise and technologically advanced solutions. We are the only HR software that is specifically designed for dental and healthcare practices. And the reason why this is so crucial and important is because we wanted to build a software that made sense for healthcare and dental providers, because looking at the market, if you just Google HR softwares, you will see a plethora of options that you can pick from. But you might notice once you start to go through the options and what they offer, that none of it aligns with what you're doing on a daily basis working in the healthcare space. You'll see a lot of features that you don't need. You will see a lot of features that maybe your employees don't need to have, or it just doesn't line up with your values and how you want your team to function. So HR for Health is really special in that way, because we want to give a platform and software for healthcare providers, specifically dental and healthcare, that need to run their team efficiently without it being way too overly complicated. So that is your rundown of HR for Health. And now I'm going to pass it over, I think, to Ryan.
Yes. Hi, everyone. Do you ever wonder why software works the way that it does? Who made the decision for this feature, but why not that feature? If you are currently a client with HR for Health or thinking about becoming one, today we are going to answer the 17 things that we don't do and why. So there are reasons behind the decisions that we make. But before we do that, we're going to take some fun poll questions. So bear with me here. I got to figure out this poll thing here. Okay, let's see. So you guys should see on the screen, do you currently track your employees' rest breaks? So go ahead and select one of the following, yes or no. And we'll give it a few seconds here. All right, the next question is, when your employee forgets to clock in or out, are you or a supervisor editing that employee's timesheet? So yes, no, sometimes. Go ahead and submit. Like so far, sometimes people do it. All right. Next question. Do you currently track PTO, sick leave, or vacation in a spreadsheet, calendar, or not at all? So actually, it looks like the, the answers here says just yes or no. So are you tracking it as anything else than a software? If yes, go ahead and do yes. If no, click no. All right, looks like we got 50-50. All right, last question here. Do you calculate overtime manually or do you use software? So a couple of different answers there. My office manager or myself, I do it manually. I use software or I use HR for Health software. Looks like somebody calculates it manually. Oh, I feel so bad for you. We're gonna get into how you can make your life a little bit easier today. All right, so it looks like 50-50. All right, moving on. So what we don't do. So the first thing that we do not let you do is function out of compliance. And for HR for Health software, we really don't want you to be functioning out of compliance. We were built with your industry and compliance in mind. For those of you who do not know, our founder and CEO is an employment law attorney in the healthcare space, and his wife is a pediatric dentist. As such, he ended up hearing all of these easily avoidable claims that come in from his wife's colleagues and friends, and he wanted to create a solution to help them avoid these claims because they were avoidable. And thus, HR for Health was born. So how does it help you stay compliant? First and foremost, each account in HR for Health is state specific. So it's based on your state. This means that your customized handbook that you create in our software, your new hire documentation, and your timekeeping are all based on your state's laws and regulations. Your handbook will contain policies that are needed for your state. And if there are any new updates to those policies or new policies in general, your handbook can be automatically updated with that information. So no manual work on your end. Just recently, we did add a new pregnancy law in June called the Pregnant Workers Fairness Act. And we added that automatically to your handbook. So you didn't have to do anything. Next, your new hire checklist will have all the mandatory federal and state forms, as well as any updates to those forms. So we recently just updated our new hire checklist with the new I-9 form. Outside of your handbook and documents, we provide you with a robust timekeeping system. So our time clock is IP specific. It tracks overtime based on your state laws, tracks time accruals, and your employee's electronic thumbprint. So next, we have break tracking. So we often receive requests for a feature to track rest breaks, not meal breaks. We do not offer a feature to track rest breaks and instead provide a banner at the top of the screen when an employee clocks in, reminding them to take their mandatory meal and rest breaks. And the reason for this is if an employee forgets to mark that they have taken their break, they could potentially say that their employer did not let them, which may not be true, but that's how it looks. And our partner law firm has found that not tracking rest breaks has actually helped them in court with these types of claims because the employer is only responsible for letting the employee know that they have the right to take their break. Next, we have clock in from anywhere. So our software does not allow employees to clock in from anywhere. Employees can only clock in from an IP address that you or someone you have provided access to has approved. This ensures that the employee is ready to work when they clock in and not, next door getting coffee or down the street. They still have access to the software in case they need to request time off or review an alert. Maybe you sent them a document, but they will not be able to clock in. They can create a manual timesheet entry, but there is a caveat to that. Anytime they create a manual timesheet entry, you will be alerted and you can then see where they made that timesheet entry from. So what IP address, if it's not yours, as well as when they did it. So if they did it at 7 a.m. and they weren't supposed to be at work until 8 a.m., Obviously, that would be incorrect. Next, we have mobile clock-in. So our software does not allow mobile clock-in. Kind of, it actually does. But we have some things in place to make sure that you choose whether or not they have this access. So we typically do advise against mobile clocking in and clocking out because employees could use their phone to clock in as they're entering the building or as they are putting their stuff away, making coffee, maybe eating breakfast. We have had clients in the past with this pain point and employees who take advantage. So having them clock in from a computer or a tablet ensures that they are actually ready to work. Now, with that being said, we know that being flexible is key, and that what works for one office doesn't necessarily work for another. So we do have a preference where you can turn on mobile clocking in and clocking out. And keep in mind that if it is on, they still can only clock in from an approved IP address. So they would need to still be at the location. All right, next we have, we do not allow for time manipulation. So what does this mean? HR for Health is a cloud-based software and not actually a desktop app as some practice management systems. So when you do have a desktop app, employees can change their time on the computer if they are looking to, change the time that they clocked in. And for obvious reasons, we want to prevent that. We have had clients in the past with this pain point, and so the fact that our software is a cloud-based system, they are not able to actually change the time on the computer to change their timesheet. It's based on whatever time zone that you're in. All right, next we have editing. We don't stop employees from editing their timesheets, which sounds a little crazy, but there's a really good reason for this. So our software allows employees to edit their timesheets, but this is not without a checks and balances system. So they're not just doing this without, oversight. If an employee edits their timesheet or creates a manual entry, it will alert that employer or manager so that they can review the entry and approve it. And the why behind this. Having the employee edit their timesheet not only saves you from HR risk and liability, because that entry will have the employee's electronic thumbprint, but it also takes that responsibility off your shoulders. If you have multiple employees and more than one employee is forgetting to clock in and clock out, that's a lot of extra work on your shoulders. This also helps avoid any he said, she said situations where, maybe the employee claims that you changed their timesheet, but they were actually working. So again, obviously keeping you safe from that HR risk and liability. Next, we do not block from early clock-ins. And we actually get this question a lot. We always hear like, hey, is there a way for me to stop my employees from clocking in early? We do not block employees from clocking in early or reject their clock in if they clock in earlier than their scheduled shift. The answer for why we don't do that is because they may actually be working. Maybe the employee gets there early and a patient came in early and they start answering questions. In that case, they are working and should be paid for that time. That doesn't mean that we don't have anything in place to alert you when this is happening. If an employee, we do have what's called a early notification alert, where you can set, a certain time frame that you want to be alerted if an employee clocks in early. So let's just say it was 5 minutes and they were supposed to be scheduled at 8 a.m. If they clock in at 7:54, you would get an alert saying that they clocked in early. And then you can go ahead and address that situation. Next, we do not stop employees from going into overtime. Although we do not stop them from going into overtime, because again, if they are working, they should be paid for that time. We do know that this is a pain point. And if you have employees who are going in unapproved overtime often, we have what's called a watchdog report. This is an email report that is sent to you daily and lets you know when your employees went into overtime so that those issues can be addressed. All right, the next thing we do not have is a desktop app. So we are cloud-based, and like we mentioned earlier, there's some reasons for that. So there's no time clock fraud. But what's really nice about not being a desktop app is we are cloud-based and we can be accessed from anywhere. So if an employee or you ever need to check any time off requests or handle anything away from the office, you do have the access to HR for Health. Next, we do not require you to do manual tracking for per diem employees. So, less work on your shoulders. Contrary to what some may think, per diem employees are actually considered non-exempt, which means that they are eligible to receive overtime. So if you are in a state with a daily overtime, that means that they can receive overtime for anything worked more than, for example, California, 8 hours in a day, or on a federal level, if they work anything over 40 hours in a week, they're applicable to receive overtime. This also means that those hours should be tracked to ensure that any time owed is paid accurately. So with HR for Health, per diem employees can use our time clock. So not only are their days tracked, but also their number of hours worked are tracked as well to ensure that you're paying the overtime appropriately. All right, number 11, our software doesn't make you track secondary rates of pay manually. So with some practice management systems, you may find yourself tracking secondary rates of pay for meetings, trainings, secondary job duties. This leaves a lot of extra work on your end and room for human error. With HR for Health, HR for Health has timesheet project feature where you can set up secondary rates of pay. So for example, if you have a hygienist that makes $40 per hour, but when they're training, they should only be paid 70% of that, you can set up a project for that employee to clock into. Then when you run a payroll report in our system, it will break up how many hours were paid at their regular rate of pay versus that training. Next, we do not have manual time off tracking, so we will do this for you. If you have been used to tracking time off in spreadsheets or calendars, which I think somebody is doing this manually, you can say goodbye to the hassle. HR for Health has time off tracking, which makes managing time off super simple. Once it's set up, employees can accrue while using our time clock, and you can deduct those hours from their time off request. This makes it super simple for you and your employee to see how much time off they have and have used throughout the year. This also means that there is no human error when tracking time off and no issues with employees not receiving hours that they are owed by accident, or even worse, providing hours that they don't actually have. All right, next. We do not make you do manual time off resolution. So basically resolving their hours from one year to the next. At the end of each year, if you are manually having to figure out how many hours of PTO or sick leave need to be paid out or forfeited or rolled over, that honestly sounds like a drag and would probably take a lot of time, especially if you have a large office. What we do is, if you need to resolve the hours, you can do so in HR for Health. We alert you when it's time, and then you can just go ahead and choose whether or not you want to pay out the hours, roll them over, or forfeit them. And again, this makes sure that you have the correct amount of hours going into the right place, and you're not overpaying or underpaying if you pay those hours out. Next, we do not let you forget about non-discretionary bonus overtime. So did you know that non-discretionary bonuses are actually applicable to receive overtime? A non-discretionary bonus or incentive bonus is based on standards that have to be met in order to receive such payment. So not anything like a Christmas bonus where they don't have to do anything to receive it. This is more of like a production bonus. So for example, an employee needs to do X, Y, and Z in order to receive it. These bonuses are applicable to receive overtime, and our system ensures that if an employee worked overtime during the time that they earn the bonus, our software will calculate the overtime owed to that employee when you utilize our payouts feature. So this is something that is done for you. All right, number 15, we're getting through it. We do not let you customize your overtime tracking. Although some companies out there may allow you to customize your overtime preferences, this is not actually a good thing. It can leave you open to so much risk and potentially leave you breaking the law with wage and hour claims are costly. The US Department of Labor Wages and Hour Division put out some statistics on how much back wages were paid out in 2022 alone. And just for workers in the healthcare industry, more than $32.5 million were paid in back wages. That's so much money. So if you're currently doing these things manually, or not following overtime laws accurately, this could be very costly for you. All right, we do not automatically assign your employees to holidays. The reason we don't do this is because we don't know what employees should be receiving what holiday. We wouldn't want to automatically assign them to a holiday that maybe they should not be paid for. So instead, what we do is we pre-fill the most commonly observed holidays in the United States into your account. So from there, you're able to assign your employees to the appropriate holiday, or if you don't offer that specific holiday, you can go ahead and delete them. It's completely up to you. You can also create your own, which is really nice. All right, number 17, we do not provide access to sensitive information. We have what's called customized permissions. So although some systems may be an all or nothing when providing access, so for example, if you provide access to editing timesheets, that might also approve them. Our system's a little bit different. HR for Health has flexible permission assignments to ensure that sensitive information is protected and to ensure that anything you do not want to be seen by a supervisor or a department head isn't. So for example, if you have an office manager who you need to approve timesheets and time off, but you do not want them to have access to employee documents or salary or performance information, that can easily be accomplished. And last but not least, this is just an added bonus. We do not provide you with only HR advice. We provide you with HR experts who respond quickly to ensure that your questions and important questions are answered. Our software is there to help you stay compliant, and we do have some recommendations in our software, but we also have our HR experts to guide you when you're feeling lost or have questions that need answers. And that is it. I'll go ahead and pass it back to Taylor.
Hello, I'm back. So we're wrapping it up today by saying we're keeping you safe by doing what you wouldn't expect. And that's our job, is to figure out the things that you're not thinking of, and we stay ahead of the curve so you're always compliant and HR ready. And we also don't want you to look like this picture anymore, where you're frazzled, you don't know what's going on, you're stressed about all of these HR issues that you shouldn't have to be dealing with. That's the whole point, is taking something off your plate where you can better use your time for taking care of patients, planning, doing all the fun things that I see dentists do on Instagram that does not look fun to me. So let us keep handling all of this for you. And then we have our download that I put in bright red so you couldn't miss it. This includes interview questions that you should and shouldn't ask. Yeah, there are some interview questions that you definitely shouldn't be asking. And how to conduct reference checks. You can get an offer letter template, new hire documents, so the required list of documents that you have to give a new hire, and salary history inquiry regulations, which is a super fancy way to say that there's actually laws for what you can and can't ask people about their previous history at another job. So we list out the current requirements by state and which ones you do have to give, or I should say, which ones you can't ask those questions in and which ones don't have any laws or requirements around it, which is really helpful information because I did not know that you can't ask people about that. Not that I've had someone ask me, but the more you know, it's helpful so you can remain compliant and you'll just know what you can and can't say. And that's pretty much it for the webinar today. You can go to our website, hrforhealth.com. You can call us, and if you're like me and don't like phone calls, then you can email us at hello@hrforhealth.com. We are super responsive. We'll get back to you. So if you feel shy or nervous, or you would rather just ask us a question in private, you can always email us and we will get back to you with any answers that we can provide. So thank you, Ryan, so much for today. That was a lot to go through. 17
Yeah.
things is not a short list. So I will wait a few seconds and see if there are any questions, and then we can be done for today. Let's see. I don't see any, so I think,
I think we're good.
yeah, I think so. Yeah, no questions. Okay. Well, that means we just did a really good job explaining everything.
Hopefully, hopefully.
Thank you so much, Ryan, and thank you all for attending today's webinar, and we look forward to seeing you soon. Bye.
Bye.